Howdy, folks, and you're listening to the Speak Up podcast. I'm your host, Ashley, and it's season 3, episode 2, would you believe? And today we'll be covering personality disorders, specifically borderline personality disorder, otherwise known as emotionally unstable personality disorder. Now, I'll be talking to Dave a little bit later on, but first I want to give you a quick overview of what BPD is, the symptoms, the features of it, and also the treatment and the causes for it as well. And then we'll bring Dave in and we'll talk about how it impacts his life and ask him a series of questions. So, firstly, borderline personality disorder. There's 4 main strands of sort of symptoms or the ways it affects people. The first one is emotional instability. So that could include things like having mood swings from one extreme emotion to another. And it's common to feel suicidal, then fine later on. And it's common to feel emotions extremely, such as rage, shame, panic, terror, and feeling empty. It's commonly misdiagnosed with bipolar, for example, where they also have mood swings, although, to be honest with you, it's a completely different illness. But it is commonly misdiagnosed because there's a lot of crossover with the symptoms. The second way it affects people is disturbed patterns of thinking. So, thinking that you're a terrible person and that you do not exist, having brief, strange episodes of hearing voices, hallucinations, delusions when stressed. And there's a lot of like transient paranoia involved with it as well. So you may get paranoid and you may believe things that aren't true, and you may be hearing voices and things like that. That's what's called psychosis, which is another condition altogether, another psychiatric state, which is common in BPD. It happens with BPD as well as schizophrenia, which is another condition. So there's a lot of crossover with the symptoms, guys. The third one, impulsive behaviour. So you may engage in self-harm, a desire or impulse to engage in reckless behaviour such as unsafe sex, drinking, drug abuse, gambling, going on spending sprees when you don't have the money, quitting jobs, and just making really poor life decisions without thinking about the consequences. And this, guys, is to escape difficult emotions and feelings, because people with BPD are what's called emotionally dysregulated. So they can't manage their emotions very well, and they find it really hard to manage their emotions. So they engage in impulsive behaviours, like I've said, self-harm, drinking, drug taking, gambling, all that sort of stuff. The fourth one, intense but unstable relationships. So generally they fear abandonment and rejection from others, or they feel other people are too close to them, so they push them away. They may make an effort to prevent people from abandoning them, so they may be clingy, they may constantly communicate with people, they may message people, continually, because they may make frantic efforts to not be abandoned, basically. And also, there's a kind of feature of BPD called splitting, where basically they see people as either really good or really bad in black and white terms. So a person's either really good and your relationship's really good, or and they're the best person in the world, or maybe they've done something wrong and they're not. They're the most horrible person ever. So everything's sort of exaggerated emotionally, and you're either putting people on a pedestal or you're putting them down and devaluing them. And that's what I mean by it's like a pendulum swinging from one extreme to the other. So there's a very much a two-dimensional way that people with BPD perceive the world and perceive people. Like I said, it's called splitting. That's the clinical term for it, which psychiatrists use. It's basically there's no grey area in between. A person's either really good or really bad. Black and white thinking basically is what we're talking about. That's BPD in a nutshell in terms of its features. Now, in terms of the causes, apparently the causes are unknown in general. However, research has uncovered that a lot of people with BPD have suffered neglect, abuse, or trauma, or some form of abandonment in childhood. Apparently, that's sort of like an undercurrent of it. So it could be, and I'm just speculating here. It could be that it could be a trauma response, maybe of some sort. Medication and treatment then is basically mood stabilizers or antidepressants. So it could be something like quetiapine, which is an antipsychotic. It's used to stabilize people's moods. Now, just bear in mind, we're not a medical podcast, but I'm just putting out there information that's already out there in the public domain. And I basically researched this information as part of this episode. All the information can be found in the public domain now, and it's already out there. But please do consult your doctor or psychiatrist if you're in any doubt about anything medical, because we're not a medical podcast at the end of the day. So that's a quick overview for you of BPD, the features, the causes, and the treatment. And what I'll do now is I'll hand over to Dave, and we'll speak to Dave about his experiences with BPD. I'll be asking him a series of questions, and hopefully we'll get an insight into how it really affects his life, guys.